Hello and welcome back to the Pave the Way podcast, an initiative by the FIA Foundation, where I, your host Akash Basu, speak with mobility experts and people with interesting ideas all around the globe on all kinds of ideas and issues surrounding sustainable mobility and transport planning. On today's episode, we are joined with Avi Silverman. He's the Deputy Director of the FIA Foundation, an international philanthropy in the United Kingdom dedicated to road safety, sustainable mobility and environmental sustainability. He leads the foundation's work on the global agenda for adolescents, focusing on creating safer and healthier environments for young people. Avi has also worked with UNICEF as the global coordinator of the Child Road Traffic Injury Prevention Program. In this role, he managed global advocacy and programming efforts aimed at preventing child road traffic injuries. Additionally, he's played a key role in establishing the Child Health Initiative, a partnership of international agencies and civil societies dedicated to achieving the Sustainable Development Goals. He was instrumental in advocating for the inclusion of road safety in the SDGs, ensuring that this critical issue receives the global attention that it deserves. His extensive experience and dedication have made significant impacts in promoting safer and more sustainable transportation around the world. Today, I have the honor of speaking with Avi on critical road safety challenges in Indian cities, the importance of sustainable mobility for our future, and the strategies we can adopt and have been adopted to create more people-friendly roads. So without further ado, let's welcome our guest today. How are you, Avi?
Yeah, very good, thank you. How are you doing, Akash?
I'm doing great. Lovely to have you on.
Yeah, it's great to be here.
Yeah. To begin with, I'd like to know how you got into this space, what inspired you to get into the road safety and sustainable mobility?
That's actually a very good question. Often I'm too busy actually just working to think about how I actually ended up here to start off with. I've always had an interest in kind of sustainable development issues as a whole, and you could always see that issues such as road safety and issues such as sustainable mobility, they're very, very central to everything that's done in a city, in a country. It has a fundamental impact on the way we live our lives, but there are areas that are often kind of neglected, or they're kind of taken for granted. I mean, everyone has experiences in getting about, in mobility, in going about their lives, in their neighbourhoods or in their cities. But often people in general and policymakers as well kind of take it for granted and just allow a kind of approach to all of this that has a real bad impact, a real negative impact on people's lives, and don't address it. So I think I was really taken by that as an area to work on, that actually you could see that there were some instances where there could be some real change that could come about very positively. You could have an area where you could have a huge impact, but one in which often isn't being addressed, and that was, I think, probably the attraction of working for the FIA Foundation, is that we can go in with the FIA Foundation, work with partners around the world, and address those kinds of issues that aren't normally addressed, and you can see real huge change to the way people live their lives and sort of positive impact that can come about. So I think that was something for me that really appealed, and it sort of kept me going working for the FIA Foundation. We've evolved, we've developed, we've our partners around the world have had some amazing results, and we've kind of been on a really interesting journey that's continuing in these kinds of areas, and great to be working on those issues.
Yeah, I mean, I think you mentioned that mobility, and especially sustainable mobility, is sort of taken for granted to an extent. It's such an important part of everyone's lives, but it's not really considered in the average person's thinking. Just how important is promoting sustainable mobility as opposed to, let's say in India, we have a system which caters more to cars, and it's hard to fight that system, right? How important is promoting, advocating for sustainable mobility, and maybe how do we get there?
Yeah, I think it's obviously it's vital, really, to address sustainable mobility. As you say, you do have a way of doing things that is primarily car-centric. Is the car dominates everything that's done, and it's really interesting when you think about it. I mean, it's again, it's something that you just kind of, in my country, we just grew up with the car, and we really do, we don't even think about it, but it has really influenced and impacted everything, the way our cities are shaped, the way everybody goes about their business, and then right the way through as the FIA Foundation focuses on to our health. So it's an area that you do have to look at, and the importance of sustainable mobility, it can't really be emphasised too much. It's the sort of the way that generally the way cities and communities go about their lives and businesses with a very kind of big focus, big domination of vehicles, of the car, of private vehicles, leads to a lot of positive things. Leads to, and this is the reason why it's come about, is people wanting to have their own autonomy and to have, their own control over how they get about. And there's also all the issues of, as soon as, and you see this in India in particular, and other very fast developing economies, where people start to earn some money, start to, get a job and get more of a kind of middle class lifestyle and existence. One of the first things that they'll do is go and buy a car, go and buy a family car, and that's quite reasonable, and obviously what happens. But what it leads to is a completely unsustainable situation. That it leads to a situation where you've got to build more roads. You have the classic kind of congestion that we see in big cities all around the world. You have the pollution, you have the road traffic injuries. It would be a really good idea for everybody to have their own vehicle, and quite possibly all 7 billion of us on the planet having our own vehicle, but it just cannot be sustained. There is no way that you can move populations around like that and that people can access employment. And so what you see inevitably is that you have people that can afford it, who will be able to buy their own vehicle, but you'll have huge amounts of congestion, you'll have enormous pollution, carbon emissions, and you'll have road traffic injury as well. And then you'll also have a huge section of the population that won't have access to a vehicle, won't be able to afford it, and in obviously the classic thing, you don't need me to tell you, in an emerging economy, in low middle income countries as well, the majority are having to get around are either pedestrians or trying to use public mass transport if that's available, or they're taking that first step and being able to maybe get a two-wheel motorcycle, if that's something that they can afford. And then we're seeing huge issues. Either public transport isn't invested in and available for them, or it isn't safe enough, or they're trying to get around and the infrastructure just is not catered to their needs, and that has, you know, disastrous consequences. So, you know, all of that kind of just leads to this conclusion that you do need a different way of approaching that, and it needs to be something that, if we're thinking about urbanisation and we're thinking about the growth and development of our cities, and obviously India is a huge example of that. I think in India, over the next couple of decades, we're going to be looking at by far the majority of the population living in cities.
Yeah.
I can't remember the statistic, you'll probably be able to tell me better than I would know, but we're going way over the 60% of the population mark going into urban development, and beyond as we go into the next few decades. And we need to be able to find a way that is sustainable for people to get around. And the kind of car-centric approach and the sort of dominance of the private vehicle is not going to be able to do that. 1 billion people in India, majority living in cities, and this just simply isn't the case that you can have the kind of car as the top of the hierarchy and everything geared towards private vehicles. And in any case, there's the climate agenda. So, you know, you've got the big focus on electric vehicles, electrification, and that in itself as well, you look at in terms of the whole picture, and you know, that if you have an approach that is still kind of very much focused on private vehicles, that's not going to work either. So yeah, I mean, we're at a big juncture. We're at a very interesting time. And kind of, you know, there needs to be a serious rethink about mobility, sustainable mobility, and in a lot of places that's happening, and there's some really good approaches being taken, and there are some really good examples of policymakers, governments, cities where they're thinking about this and they're investing in it, and they're going beyond the kind of traditional model of just private vehicle use, and that, you know, that's interesting where that's happening. Yeah, I think we definitely say there needs to be more of that.
Yeah, so I think you have given a good account of what isn't working. I'd love to get to know a little more about what does work, like these projects or these governments that have taken steps toward building a more sustainably mobile society or areas. What has been known to work in the past when it comes to the shift from maybe car-centric to a more sustainable way?
Yeah, I mean, broadly speaking, it's you know, it's shifting to that kind of combination of being able to have good, safe, and clean public transport, mass transport, but one that also is linked to a way to get people on those shorter journeys in the last mile, and the kind of personal transport that's linked to the mass transport, for it to happen, a kind of whole system approach to all of it. And we have a big focus on active mobility, so be able to integrate in active mobility into all of that is really, really important, and something that doesn't tend to get done generally everywhere in a lot of places. It tends to be the exceptions rather than the norm, where you have a focus on active mobility. But the need for active mobility and the benefits of active mobility are very, very apparent and very very clear when you look at them. I mean, if you invest in active mobility, you're going to have a range of what people would call the sort of co-benefits.
Yeah.
So, you're going to, physical health. One of the big things is a big focus in public health on non-communicable diseases, on areas where we have a real deficit of physical activity in people's daily lives. And if you have active mobility, that's one really effective way of addressing that. Walking and cycling is a major way that you can get people being more physically active, and you can have the health benefits to all of that in terms of reducing non-communicable diseases, and there's strong evidence around all of that as well. So for that reason alone, a focus on active mobility is something that should be taken forward. What's interesting is that most of the time where you get a government or a city looking at what they need to do on public health and how they can help create an environment where their population is going to be healthier, and how you could perhaps reduce the burden on overstretched health services, which is a huge issue in just about any country, for every country you go to. What they often don't integrate in is transport. People don't automatically think, oh right, well, we need to address transportation here. That's going to be really important for public health. But it is. I mean, if you look at what can be done in terms of encouraging people to walk and cycle, and how that would help reduce the health burden, that is something that really needs to be addressed. What we also do is we sort of connect in the issue of road traffic injury into that. You can have places typically where they've done a big focus on walking and cycling, and they've invested in it in the sort of more Western European type of environments where they've focused on walking and cycling and providing cycle lanes and facilities for people to walk. They don't have so much of an issue with road traffic injury to start with, or they're able to do things like reduce speeds and make the environment safer, build on what they've already been doing and improve and enhance the level of safety so that people can walk and cycle without there being a kind of increase at the same time in road traffic injury. That's the real challenge, is that you want to get people walking and cycling. You want to be able to get people walking and cycling in the kinds of settings where people are having to rely on their own feet and they don't have access to vehicles, and particularly in low and middle income countries, that's going to be a large proportion of the population. But you can't do that without the safety. And if you try and encourage people to walk and cycle, they're either not going to do it, or they're going to want to try to use private vehicles where they can, if it isn't safe. And then when you actually do manage to get people walking and cycling, or people have to rely on getting around as a pedestrian more, or on two wheels, there's inevitably going to be an increase in road traffic injury if the safety isn't focused on, and if it isn't invested in at the same time. So that's the big area that needs to be looked at. You can have enormous benefits, but you can also have big negative impacts if the road safety isn't there. So it's key to the whole thing, to kind of getting people to be able to walk and cycle, is to be able to have that safety. And when that is in place, you can also get further benefits as well. We're talking about, being able to, as you said earlier, if you're kind of shifting people away from private vehicles to other modes of transport, whether it be kind of walking and cycling connected to public transport as well, you can then start to look at big reductions in carbon emissions and big contributions to climate targets as well.
Yeah.
I mean, obviously, if you're walking and cycling, it's going to be the lowest form of carbon emissions that there is, particularly walking. Obviously, the very lowest carbon emissions. So there's that, and then there's actually growing evidence around the economic benefits as well, which often is underappreciated. That if you create an environment that is safe and one where you're reducing the level of reliance on private vehicles, and people, you have a more compact city, and one which people don't have to travel such huge distances to be able to access services. That it's designed in a more accessible way, and then you can have walking and cycling as well. You can get economic benefits to that as well. People aren't spending all of their time stuck in traffic jams, stuck in traffic, in congestion in the city, and that is actually a huge economic downside to the way we currently do our travel patterns and our transport systems. And if you can get people walking and cycling and able to, go and then spend money in businesses and access employment more easily and quickly in that way, then you can have big economic benefits as well. So you can look at it in terms of kind of multiple benefits, to public health, to the environment and air quality, and economic benefits to the whole thing as well. And where it's been done, it's been shown to have really strong results in those areas, and a good area to invest in. I think the thing is that it doesn't get invested in as often as it should do. I think it's a more difficult investment to make a lot of the time. Kind of the easy way to go in is just to, and we see it quite a lot, is donors come in with governments looking at big projects that they can invest in, and they want to do mass transit, they want to do like bus rapid transit, BRT systems, they want to do metro systems, and you get big funding coming in for all of that, and the kind of impact that has on neighbourhoods and on the connections that people might have to those transport hubs, and the way that people would actually use them and what's needed in terms of safety quite often does get overlooked, and there isn't a kind of overall approach being taken a lot of the time to those kinds of big projects. And that's where we have had situations where, say, a BRT system has come in and there's been an increase in road traffic injuries because they've not done safety for pedestrians or safety for people on two-wheelers around where the BRT projects have been done, and they've not looked at how people are trying to access the BRT in terms of being a pedestrian or being on two wheels and that kind of issue. So you do get a lot of that. But as I say, there are good examples where they've looked at that. I mean, there's some good examples of work that some of the development banks have funded with cities where they've actually funded the kind of pedestrian and cycling infrastructure that needs to be in place alongside the bigger transport, or connected to the bigger transport projects as well. And those are some of the best examples of the work that needs to be done.
Yeah, I think that's a really interesting point, especially considering the BRT, like the Delhi BRT. I think it began in 2008 and it was shut down about 4 years later because the idea was good, but the implementation was not really there. They hadn't set up the lane well. The last mile connectivity wasn't really there. Cars were getting into the bus lanes. It was unsafe for pedestrians. But then you look at the Indore iBus, which is another BRT system where it was just implemented with with through a much better system where all the problems were considered and it was implemented in a much better way. So the idea is not always good enough. Like it requires a much broader look at all the potential issues and all the things you need to solve. So I think that taking a BRT system specifically, you can see in India where there has been a system that's made it work, but also one in Delhi where it failed miserably, and even like our newspapers were all against it. The public perception was being changed towards like the BRT is ruining our roads. We've given a lane to these buses which is taking away space from cars. Especially public perception, when you put it out in a newspaper like that, it's so much less likely to succeed.
Yeah, it's interesting as well. I mean, you often get, with a situation like that, you'll get investment that's gone into that project, into the BRT, that's then obviously not achieved what it should achieve. And you see that in some places, the high levels of investment going in, and then they look at it and they realise that actually, the usership isn't at the level that it should be. And part of it is exactly as you say, they've not addressed the kind of connectivity, be it pedestrians or cyclists, or other forms of micro mobility or two-wheeler motorcycle transport connecting in. They've not addressed any of that. And then they have to go back sometimes. You see some of these projects, there's instances happening across Asia in particular, and Latin America as well, where they've had to look at how to revise the project and see how they can increase usership by making it safer for pedestrians and cyclists. So it's interesting, and that's the worst situation, is when the intentions are good, and with Delhi's example there, the intentions around BRT has been a good one, but it's just not addressing what those kind of knock-on effects are going to be, what the wider kind of priorities are going to have to be. You get into difficulties with all of this, and then you lose. Politically, it can be a problem as well. I mean, that's the thing, is it's very quick to lose, can be very quick to lose public support for these kinds of initiatives if they're not done in the right way. And then that can make it more difficult for when you actually want to go in again and get a more sustainable approach going as well. So it can be quite difficult.
Yes, so we had met yesterday, and I think I had seen a few brochures, FIA Foundation brochures. One of them had the title "Design for Life," which I just thought to be quite an interesting line, and I was hoping to elaborate on what that exactly entails.
Yeah, I mean, it's something that we put together really to look at all of the work that we were doing, and to be able to make a kind of point about what we want to see done. That, first of all, as we were discussing earlier, you can have an approach where you actually don't really think about the kinds of issues in terms of sustainability and equity and public health and the environmental impacts of what's being done, and often it's we just want some kind of very quick economic benefit. We want to get people moving as quickly as possible, goods moving as fast as possible, and that's the kind of approach we're taking. Or we could design for life. We could take an approach where we look at much more rounded objectives in terms of what is it that are going to be the impacts of a much narrower way of doing things, and one that's just kind of prioritising the car, the private vehicle, economic growth in a very narrow way, rather than taking a kind of broader approach that we're interested in, which is what are going to be the public health impacts of that, and what are going to be the environmental impacts and the longer term impacts of the approaches that need to be taken. Kind of looking at it from that perspective, you get a very different view of what the costs are, what the benefits can be, what needs to be done, kind of moving forward as cities and urbanisation grows and motorisation, also is increasing population growth as well and demographic change. We're looking at how you can actually account for all those things and how you can actually, design in terms of the transportation systems and the infrastructure that needs to be in place, the urban design that needs to be in place, but also the policy design, the policy responses to all of this. So that's the kind of thinking around that report that you saw. I think it's important when we see it being done really well. You can have huge positive outcomes. One example is the work that we actually started off in Brazil a few years ago, where we actually put a relatively small amount of funding in to a couple of pilot projects. We really wanted to establish the effectiveness of what could be done and then see if that could then be further scaled up. And I think that's a big focus for us, is being able to work with partners that have really strong expertise, put in some funding, and then have that be taken on even further. And that's exactly what happened where we were working in Brazil, in Rio, worked in a couple of very of poorer districts of the city, did a focus on school journeys and school areas in particular, and did a kind of assessment work of what the risks were to children and young people going to school in terms of road traffic, and how they could be better protected on the roads, and how you could reduce road traffic risk and road traffic fatalities and injuries, which is a huge issue everywhere, and Brazil included, where it's a huge burden on young people in particular. And did all of that, and did that in a couple of smaller projects in a couple of districts, and then worked with partners to try to scale that up a bit more. And the result of that has been that the big development banks have come in, and the city of Rio has taken it on with great partners that are working in Rio, partners like you actually have an organisation affiliate here in India as well, the World Resources Institute, WRI. So WRI India, you've also got WRI in Brazil, and an organisation that also works in India, ITDP, that you'll know, Institute of Transportation Development Policy, ITDP, that also work in Brazil, and together they've taken this on, and they've worked with the city, and they've actually achieved huge impact and scale up. They've got the World Bank to come in. The city has worked with the World Bank on it, and there's been an increase in funding for that work. And we're now seeing a program of about $135 million doing safe journeys, safe school journeys, lowering speeds around schools, working on safety for pedestrians, young people walking to school. That's connected also to the work around active mobility, walking and cycling. They've got a policy across the city for walking and cycling, which is being funded and expanded, and investment going into the infrastructure for all of that as well. So from a very small start, kind of small seed that with the partners in Brazil did so much great work to plant, that small start has resulted in a huge impact across the city, and that's exactly the kind of approach that we're trying to take, and great to see those results coming about there. And it's similar work being done in lots of countries around the world as well. So yeah, it's really encouraging to see that kind of thing being taken forward.
Yeah. Does it sort of create a framework that can be used in, other places? Suppose like the work done in Brazil. Is it more about scaling the work in Brazil to see, how effective, small scale policies can be done on large scale, or does it also, in a way, create a framework that can be applied to other countries, other cities that need similar sort of policies?
Yeah, it's a good question. I think getting the frameworks right, you're right to ask about that. It's not easy to do. And I mean, what came about in Brazil was really a result of the city, the partners in Brazil, having the kind of vision and expertise to be able to put together a program that could really address those kinds of issues, and then being able to work really effectively with the financing institutions and the development bank, to be at World Bank, to be able to deliver all of that. And it is something that we would really like to see be replicated, similar kinds of approaches. As I say, it does happen in other places as well. It doesn't happen often enough. It's not systematic enough. I think it's something that in different areas, a government or a city and maybe the development institutions try to do. Like they want to have, for example, in Rio, what it combines is it combines the road safety with the strategies on reducing poverty, with gender equality as well, ensuring that it's safe and secure for women and girls to be able to travel around the cities connected to that, and also the climate objectives as well. So they've got climate targets built into that program, hence the kind of approach that links with public transport, walking and cycling that I was talking about earlier that they're doing in Rio, and resilience, which is a big issue for many countries, including in Brazil, where they're already having huge climate impacts. We're seeing the climate impacts here. Yeah. In India as well. I mean, we're sitting here and the temperature outside is about 48 degrees Celsius, I think, today, and you can see that is becoming more common, that extreme heat as well. And in Brazil, they've got flooding and they've got other climate change impacts. So they're really focusing in on what needs to be done in terms of resilience. And this kind of approach to infrastructure, an approach to development that is more sustainable and looks at how the infrastructure can serve people better and how it can adapt, how it can be resilient to climate change as well at the same time, is really important. And it's those agendas that need to be brought together. And that project's a really good example of where they are. But often what you'll see is kind of everyone, the big institutions are trying to take an approach where they're trying to meet climate goals, they're trying to meet goals for equity or economic development. But those kinds of approaches, miss what needs to be done to really deliver that and how to connect it together. So we'd like to see that framework, the kind of framework that's been taken in Rio and some other places as well, yes, be used elsewhere as well to kind of connect in the different objectives that need to be delivered on.
Very interesting. One thing I wanted to ask about is when I was doing my research is that you were integral in involving road safety into the SDG, the Sustainable Development Goals discussion. Can you just tell me a little more about that? How that happened, like how, I think now it seems intuitive that of course there are sustainable development goals where road safety or sustainable mobility are very relevant, but just your role in it and how that came about.
Yeah, I don't know, sort of this conversation sometimes makes you feel slightly old because the Sustainable Development Goals were put together back in 2015 now, so we're talking about it's nearly 10 years of the Sustainable Development Goals, and the work that we were doing before that was even earlier, you know, the kind of advocacy that was being done on these kinds of issues going into the Sustainable Development Goals was even before that. So you sort of look back on it and think, you know, it feels as though it's a different era and a different world, and very, you know, you feel as though it was a different lifetime that these things were done, actually. But it was a good example of, you know, being able to influence bigger agendas. And I mean, what's going to make me sound like a really old man here is talking about how things were done even before the Sustainable Development Goals, which was that, you know, road safety didn't even feature in any way at all. So that was the point. I mean, you had an approach to global development in what was before the Sustainable Development Goals where you didn't address an issue of road safety in any way. It just wasn't there, didn't feature. It was still a huge impact, just as it is now. We're talking about over 1 million people that were being killed from road traffic injury, even before the Sustainable Development Goals, and, you know, millions of injuries as well, and no real kind of coordination around what needed to be done. No, I mean, it was an even worse position because without it having that recognition and having that focused target, it was even further down the agenda for policymakers and for governments, and the sort of approach to development didn't for a second really think about it in any meaningful way at all. So that did change, and that was the whole point about trying to get it into the Sustainable Development Goals, was trying to build the level of attention and focus and financing and action around road traffic injury. And yeah, I mean, it was a big push to get it in there. It was a really big effort to get something like road safety in there. I mean, it's in there in 2 targets of the Sustainable Development Goals. To get 2 targets like that into something like a process like the Sustainable Development Goals is a really, really difficult task.
Which ones?
And it's in the health. I remember when we were first going about this, and FIA Foundation was really at the forefront of all the work to get road safety in, and we were thinking at the time, you know, where does it go? I mean, that's always the issue with road safety. It's always been the case, and it was the same back then as well, is that you can connect it to lots of different areas. I mean, as we say, it's a real cross-cutting issue: transportation, health, infrastructure, the economy. There's obviously the connections to climate as well. So it was a question of where. We focused in on the health goal of the SDGs because health really does get a lot of prominence. I mean, it's a major priority. Road traffic injury has a huge health impact in terms of injury and fatality, and the kind of profile of it in terms of the scale of it globally, and the comparison between road traffic injury and other major health epidemics and health priorities globally that you can think of would all be addressed within that health goal. So we wanted to make sure that it got that kind of focus and attention that other big health impacts got. The interesting one about road safety was it's the one that is man-made. I mean, it's not a communicable disease. It's something that we've kind of inflicted on ourselves. But by the same token, it's something that we actually have the ability to address and reduce as well. We always used to focus on the fact that you don't need to invest and search in a big vaccine for road traffic injury. It's not, the solutions are already there. You can do the kind of vaccines that are needed in the infrastructure and in the focus on key contributors to road traffic injury like speed, looking at how you can reduce speed and how you can shift as well, as we were talking about earlier, from vehicles and roads onto more sustainable forms of transportation, and if done in the right way, you can reduce the health burdens and negative impacts that way. So it went into the health goal, focused on the health goal, and that proved very effective. And what was interesting when we were doing the advocacy is that, particularly from countries that have very high burdens of road traffic injury, there was a lot of resonance, there was a lot of support for that. People could automatically see that it was one of those health burdens that if we were going to have a new approach to development, that's what the SDGs were trying to do, that was a bit more cross-cutting. And there was a lot of interest in how can we approach these kinds of health issues, not just from a perspective of health, but how it connects in with other areas of development. That there was a lot of kind of resonance around that and support for that. So we managed to get it into, after a lot of hard work, we managed to get it into the health goal, and then it also got into the city's goal as well. So we'd sort of had this, bit of, you were never quite sure, it was a bit uncertain exactly how it would get in, so we decided to also focus on the city's goal to make sure that it got in. I think we were probably more successful than we'd ever imagined we'd be, because it got in both the health goal and the city's goal. It was quite successful from that point of view. But we always knew once it's in the Sustainable Development Goals, that's not really in itself going to change things. It's not going to, unfortunately, like flicking a switch and suddenly everything's going to be all right because it's in there. But it gives you that kind of platform to be able to then go on and start to get some improvement going and some advances going and a bit more momentum going and wider recognition as well, and having a specific target that can be widely recognised and focused in on is very useful to have as well, and it's kind of resulted in the work ever since 2015 over the decade that's followed, and there's been some really good advances and results off the back of it as well. So yeah, it's been quite important.
Yeah, it seemed like it contributed several steps in the right direction. It's just a really long staircase.
I think that's that's a good way of putting it. It's sort of, at least it's kind of given a direction and it's given a kind of definition to what really needs to be done, and it's situated road safety in the way that it needs to be addressed and understood, and has actually led to some important work that's followed on from it as well, and some good results and achievement. But yeah, as you say, I mean, there's a lot more. There's a lot more there, and I mean, we won't go into it. This is a subject of an entirely different podcast, so let's not go into the Sustainable Development Goals as a whole. But there's lots of questions around the Sustainable Development Agenda as a whole and Sustainable Development Goals going forward. So it's not necessarily just been sort of very straightforward. Oh yeah, this whole thing is wildly successful and we can all congratulate ourselves and move on to something else. That's not the case at all. It's really it's been particularly over the past few years, it's thrown up a lot of challenges around the whole of the Sustainable Development Agenda, and that obviously affects what we do as well. So,
yeah. To finish this podcast, we usually ask the question, given the name of the podcast, how do we pave the way towards a better future? I think we've sort of discussed that a lot. I think I'll ask it in, yes, how do we pave the way towards a better future, but also do you see a future that is positive? Like, let's say in India specifically, we have a 2030 goal to reduce road traffic injuries by 50%, but we had a 12% increase from the previous year just last year. So it almost seems like we're moving in the wrong direction.
Yeah, so that's a big question to end the podcast on. I think you're now trying to get another podcast out of this, aren't you? But I think it's worth focusing on this a little bit, particularly India's situation. And India always, we all know, it's not saying anything new, we know there's a huge burden of road traffic fatalities and injuries in India. We were looking at the data just over the past couple of days, hearing the meetings that we were having with lots of different partners, and it is quite shocking. It's the new data that we've got for India. The official figures were showing just over 150,000 fatalities, and that's the kind of official figures that World Health Organization has also been using. But then the figures from the government as well, I think, were even higher than that, based on more updated data coming through. So we're actually looking at over 160,000, not 150,000, and maybe even towards 170,000 in the official figures. That there's been some comment on the fact that those figures as well are underreported, so it could be even greater. And look, even without the figures, you can see that things are not as they should be if we really want to reduce the level of injury and fatality. And the level of injury and fatality, I don't think anyone would ever ever say that it's acceptable.
Yeah.
It really isn't acceptable at all. And so what can be done? As you say, there's a good focus in the strategy 2030 with a 50% reduction, and it's great to have that ambition. There's also been recently some funding that was agreed and was starting to be delivered and implemented. Good progress that appeared to be made over India's national strategy and funding to get a really sharp improvement in reducing fatalities, a 30% reduction by 2028, I think, or certainly over a sort of 5-year period going into towards the end of this decade, but before 2030 itself, and getting some funding in to deliver that, and working with having a national agreed funding that could work with the states and work with the development banks to really get that amount of progress going to accelerate. And that was something that if you were here, you would say, absolutely, I'm sure you would say how important getting that in and being able to deliver on, say, a 30% reduction even, and having the scale of funding that was needed. It was a $1 billion combined funding with the government and the development banks coming in to deliver that 30%. You would say how important that is, I'm sure. From our point of view, from outside, we were looking at India and we were thinking, this is tremendous, because there's such a need to address this. As you say, the data is shocking in terms of the level of fatalities and injuries, and it's really, really important. Great that this is being done to that scale, that actually people are thinking at that level, and that there's such a kind of reasonable attempt, like looking at all of the kind of major areas that need to be addressed, going into state level to be able to deploy the kind of overall response that's needed, sort of safe system approach that gets talked about in road safety a lot, that has to be in place in order to have the sort of results that you would need, all of that. And the way that the funding had been done looked great. The only problem is that's not really being taken forward, which is a huge tragedy. I mean, that's understating it. I mean, to call it a tragedy, it's catastrophic that it's not being taken forward. It's kind of stalled, I think. I think it's been delayed. The funding's stalled. I think it's been a victim of maybe being in a particular area of the government that they haven't managed to advance it. But it's an opportunity that's sitting there. You know, if India wants to make progress in reducing this horrendous burden of road traffic injury that's growing, as you say, then what's incredible is that it has a really good step that it could take to do that, but that isn't being taken forward. It's quite incredible that that's not happening. I mean, it would be a shame if it wasn't further, if it did just stall and it wasn't in any way taken forward. It would be nice if there's like political leadership from the very top. I mean, I think it would need the kind of political leadership from probably the Prime Minister's office, right at the top, to kind of drive it all forward and to say, look, actually, this is a priority for the country. You know, this is having that level, having 150,000+ is something that needs to be seriously addressed. And we have this plan, so let's deliver on it. As opposed to, we have a plan, but you know what? We're not really going to look at it. We're just going to leave it sitting there. That would be a real shame if it kind of just sat there and wasn't, the steps weren't taken. I don't fully, it's difficult to see why it wouldn't be taken forward. I know there's always issues that can be with government on these things, but I think if it could be reactivated and addressed, and the other thing to say is it's not like it's entirely possible to make progress. Yeah. It's very, very, I'm not saying it's easy, but they have a program in place. They'd agreed a way of working with states, and I know there was an issue over which states and whether it could be all states in India, and this particular financing was only for, I think, 14 of the states. But look, you can worry about what isn't in the program, or whether the program should be better, or you could sort of pick issues with the program, or you could say, look, let's get something done. Yeah. Let's start to actually deliver on this in a way that we can, and then build on it, and then make it more expansive, and then improve on it as well. But that's the real shame with this, is that a pathway towards getting a 30% reduction even over the next few years, which is hugely needed, was there and is there, and could be taken forward. But at the moment, that is kind of sitting there. That I think would be a real huge tragedy for India if that wasn't addressed, if that wasn't unlocked and able to have an impact, and with it not being in place, the fear is that we get what we're having at the moment, which is this kind of ongoing increase, which is, the levels were too high to start with, and if it's going to continue in that direction, that would be a massive issue.
Yeah, I totally agree. And Mr. Prime Minister, in case you're listening, we can maybe take some of these suggestions on board. Anyways, it was really great talking to you. Thank you so much for coming on the podcast. It was really insightful for me, and I think it will be very insightful for our listeners. And I think there are a lot of topics in which we could have gone a lot further as well. So I hope we get a chance to maybe conduct another conversation again soon.
No, thanks. It was a real pleasure to be on the podcast, and thank you for having me on. Really, really appreciate it.
Thank you very much.